What are the conference trends impacting clinical decision making? I mean, I know that's a big question to start off with.
Yesterday we held our senior advisory group meeting, and this is a gathering with BD executives with some senior pharmacists from around the country, leaders of some of the largest health systems. Great conversation. What we heard about, number one trend, the opiate crisis and how it really affects and impacts acute care hospitals.
Sure.
And while in the community there's a lot going on with the opiate crisis, there's still a lot to be done in the acute care environment.
Yeah.
And what these pharmacists are looking for is tools to help them identify patterns of diversion. What diversion is, taking medications from legitimate use for personal use primarily by healthcare workers and caregivers, which can result in impaired caregivers working and so forth. So big issue for them. Second trend is the migration of care into ambulatory and outpatient environments and how pharmacy needs to work with the patients there, primarily around things like being able to make sure patients take their medications. It's called adherence, making sure patients take their medications according to the instructions. And also in the transitions of care, making sure that the care is consistent in between the hospital setting and and these patients going out into the environment. Third thing we heard about is there's a lot of concern around reimbursement changes from a regulatory perspective, particularly 340B it's called, which is a program of discounting for drug purchases for hospitals. It looks like there could be some changes afoot with that, and with that, pharmacists are preparing for that. Revenue cycle management, things like that, very important for them. So those are the few of the trends we heard about.
Just those few little things,
Yeah.
that's all. Okay, thank you.
How does